Once again, welcome to Face to Face, a series of virtual supports for CPS parents during the COVID-19 health crisis. I am going to continue. Okay, so as our district continues to navigate through challenging times, we want our families and students to know we are here to support them. So one way to support families and students, the Department of Family, Community Engagement and Education, or Phase 2, has launched a series of virtual workshops to help families build on their strengths. So offerings are designed by experts and include various topics in the following areas: academics, mental health, arts and self-care, socio-emotional learning, technology assistance, and direct access to experts from the field or ask the expert. If you would like to be put on our mailing list, you can register at bit.ly/face-parent, and that link will be dropped in the chat. So the session will be recorded. We want to share this knowledge with parents who were unable to attend today. If you wish for, that's not relevant, you don't have a camera that we can see. So if you do not consent to be part of the recording, you can leave the video call now and wait until the session is available on our YouTube channel at bit.ly/face YouTube. And if you stay, we assume you consent to the recording. So don't miss out on future sessions. We have tomorrow, we have Erie House COVID-19 vaccination myths and facts, which is bilingual. We have the Illinois Student Assistance Commission, post-secondary, which is going to be held in Spanish, and that is to help with the student loans for college. We have Chat to Learn program, English and Spanish. The following day, we have Read Up to Build. We have that session in Spanish at 3 p.m. It is four out of 5 sessions. And then we have the one in English at 4 o'clock. And then we have another session titled Character Does Matter, Leading with Your Strengths, that will be held in English. And then we have the Illinois Student Assistance Commission's post-secondary, the one that was held in Spanish will now be held in English on the 24th at 4 o'clock. And then on the 25th, we have Ask the Expert, and you will be talking to our Chief Equity Officer, Maurice Sweeney, and that is going to be bilingual. And on the 26th, we have our monthly Title I Leader Circle, spent in how to spend the rest of your funds. Our Title I district manager will be telling you how you can spend your funds and ideas how to spend your funds. And that session will also be held again, but this time in Spanish at 11:30. And then at 3:30, we have I Can with Changing Worlds is the last of a 4-part series, and that'll be held in English, and that is about creating a mantra. For more information, please email title1@cps.edu or reach out to Norma Celedon at nceledon@cps.edu, or you can call her at 773-255-9623. And again, don't forget to register for future sessions at bit.ly/face-parent. And again, please tell us how you like today's session. Your feedback is valuable. So please tell us how you like today's session at tinyurl.com/face-to-face survey. So again, welcome to the face-to-face virtual classroom. Our sessions are designed with you in mind to support your child's learning trends and to offer a variety of programs that help you build your knowledge and growth around various topics. We offer weekly classes, as I said, which are hosted live, recorded, and then uploaded to our CPS YouTube channel for future reference. We hope you enjoyed today's session entitled How Contact Tracing Works, which will focus on how contact tracing is, and how it works, and how that will work at CPS specifically, and how it'll affect you and your students. And so for future information on future programming, please visit our website at cpsparentu.org. So thank you for attending today's session. And now please welcome today's presenter, Elizabeth Hanson and Jamie Tully. And I will hand the presentation over to you.
Hi, everyone. Can you hear me?
Yes.
Okay, great. Okay, is that PowerPoint? Are you able to see that?
I can see it. Yes.
Okay, wonderful. Well, hello, everyone. I'm Jamie Tully. I'm the Health Information Manager for the Office of Student Health and Wellness. I'm also an epidemiologist and used to be a CPS teacher. I support contact tracing in the district since the beginning of the pandemic last year, along with Liza Hanson. Liza, do you want to introduce yourself?
Hi everyone, my name is Liza Hanson. I've worked for the CPS for about 5 years at the Office of Student Health and Wellness. I'm the COVID-19 response manager and manage our contact tracing team here. My background is epidemiology as well. I got my master's of public health from UIC School of Public Health. So we're really excited to talk to you all today about contact tracing at CPS. Jamie, if you can go to the next slide. This is just our mini agenda for the day: introduction to ourselves, introduction to our department, a look at how contact tracing fits into the overall CPS reopening plan and health and safety protocols that have been put in place, the specific steps of contact tracing, and then leaving room at the end for any questions. So you can go, thank you. So the mission of the Office of Student Health and Wellness is to remove health-related barriers to learning and advance health equity in Chicago. Our vision is to create a healthy CPS that serves as a national benchmark for student health and wellness. So our department, the Office of Student Health and Wellness, falls within central office within this Chicago Public Schools organization. We have several different bodies of work that are covered by our department, overseen by our Chief Health Officer, Dr. Fox. So there's health promotion, which focuses on specific health content areas that are listed here: recess, sexual health education, gardens, nutrition education, healthy eating. Then we have our health information team that helps with the data and communications side of all of the health promotion that goes on. Student health services, so a team dedicated to providing direct health services such as health screening or hearing and vision screenings and dental exams to students. Children and family benefits, they oversee the assistance for families to enroll in public benefits such as Medicaid and SNAP. COVID response, that's where we fall. So contact tracing, vaccines, surveillance testing, we'll get more into that later, obviously. And then recently, nursing was moved over to fall under our department. So we have quite a spread of work here that we are proud to focus on. So you can go to the next slide, Jamie. All right, and Jamie's gonna go over the CPS reopening plan as it relates to health and safety.
So as we all know, this has been an unprecedented year. And since for the last year, we've really been working with the public health professionals to implement several different health protocol measures to mitigate the spread of COVID-19 within Chicago Public Schools. This is a long list of things that we've done as a district to support that. So we do have a COVID-19 surveillance testing program for staff. So we test staff who opt in and are randomly selected a couple times a week. We're also expanding this to students now that students are coming back to in-person learning. We've purchased HEPA filters and completed air quality assessments for all schools in the district. We've hired additional custodians to support cleaning and sanitizing of schools. We've purchased a lot more hand sanitizer, soap, disinfectant wipes, and distributed that all to schools. We purchased hospital grade disinfectant sprayers to help schools disinfect. They kind of look like the Ghostbusters sort of pack that you wear and you spray the schools to disinfect. We've installed plexiglass dividers in offices and at kind of those entryway desks in schools. We also implemented a daily health screener that I'm sure all of you, if you have students in CPS that are going to in-person learning, have experienced. We require that everyone wears a cloth face covering in CPS buildings. We've implemented a pod structure to support contact tracing, so keeping students in more fixed sort of classrooms so we can track who they've interacted with. We've provided public access to our COVID-19 data on our website, cps.edu reopening 2020. We've provided staff vaccinations, so we've worked to vaccinate our staff across the district. And we've implemented contact tracing since last March. So today we're really going to focus on contact tracing as a health protocol. And I just want to mention that all of these put together is kind of what we're calling a Swiss cheese approach. None of these prevention measures is 100% effective against preventing COVID-19. But our intent is when you stack all of these prevention measures together, that all together, they will help prevent the spread of COVID. So all these things need to happen all at the same time in order to be effective. So recently, the CDC, after reviewing a lot of data nationally, recommended that schools across the country do offer in-person learning options for families, particularly for younger students, regardless of the community transmission rates. They've identified specific rates in communities. So we as a city are currently in the orange level, the substantial transmission. Right now, we're actually under a 5% test positivity, but we are at 50 to 99, 100,000 person testing. 50 to 99 people have tested positive per 100,000 people in Chicago in the last 7 days. So they go with the higher transmission rate. But regardless of the transmission level, they recommend that pre-K through 5th grade remain open in small pods, like we are in elementary schools in CPS. And they recommend that grades 6 and above in-person learning would be implemented in low, moderate, or substantial, as long as we also utilize a pod structure. So we have been doing contact tracing for about a year now. And with all of that information, we have really been able to work with the Department of Public Health to identify that, schools are rarely the source of COVID-19 transmission. So to make sure that that remains true for the rest of the school year, we're going to continue using our contact tracing protocol and closely monitor all the COVID-19 cases in the district. And we, as a district, finalized the criteria for pausing in-person learning as part of the agreement with the Chicago Teachers Union, as well as following the Chicago Department of Public Health guidance to objectively and transparently monitor transmission throughout the district.
All right. So on to specific steps of contact tracing itself and how it works in CPS. So contact tracing is a epidemiological process that's used not just for COVID-19, but for other diseases as well, to understand patterns of transmission in the community for these diseases and take the necessary interventions to help reduce the spread. So what this means for this particular respiratory infectious disease is that it relies a lot on understanding who you've been in close contact with, which is defined as anyone you've been in less than 6 feet distance of for at least 15 minutes over a 24-hour period. So this is because the majority of the transmission happens through respiratory droplets, and that the existence of a close contact increases the risk of transmission between individuals. So our program is a supplement to the Chicago Department of Public Health. We focus on our own population, which consists of CPS staff, students, and visitors. You can go to the next slide, Jamie. Okay, so how does it work? First, we get a case report. We investigate the case that's reported to us by any of those types of individuals I mentioned before. If we determine that action is necessary, which would mean that there was, a potential exposure in a CPS building, then we'll take the necessary processes to notify individuals who may be impacted by the case. And then after that, we'll quarantine the close contacts if there were any identified in the case. All right, next slide, please. Jamie, can you go to the next slide? Thank you. Okay. So I've been told to go a little slower, which is always a good reminder during presentations for the purpose of interpretation. So the first step in contact tracing is the report of the COVID-19 case to us. So if it was a student case that was identified through testing, the parent or guardian would need to report that to our online form to give us the basic details we need to understand as far as reaching back out and conducting our interview, and to understand whether or not we suspect that there would have been exposure in the CPS buildings. So the two ways that it's possible to report to us is through our online form, like I mentioned, which is cps.edu/COVID results, or our Healthy CPS hotline, which is 773-553-KIDS. If you call that hotline, we have English and Spanish available, and someone on the end of the line will be able to take the information down that we need to follow up with you later to do the in-depth investigation as to the case. So one thing we want to point out is that we can't act or investigate on other people reporting on behalf of someone else. So if you hear about a case that isn't about yourself or about your own child, that someone that you have permission to share health information on, we cannot actually investigate that. It has to be the individual who's affected or the person who has the authority to share their health information. Okay, next slide, please. So once the case is reported, which would happen through the online form or through the hotline call, we'll have that report in our queue and we'll assign it to a contact tracer so that we can begin the investigation. The investigation, it consists of an interview. So if you report online, for example, you would expect to receive a callback from our hotline number that will be a contact tracer reaching out to you to ask a series of questions that relate to understanding the potential exposures that may have happened for that case, and any other information that may be relevant that will inform the public health guidance that may apply to the person who has been infected. So for example, if you report that you had your symptoms starting on a certain day, that would inform the amount of days that we would recommend that you isolate in your home away from others to prevent the spread. So the day that we calculate the start of disease is either on the date of first symptoms, or if asymptomatic, on the date that the individual tested positive. Okay, so after we investigate and we have this in-depth interview with either the parent or guardian in a student case or the individual for a staff case, we might determine from the information collected that the case is non-actionable. So what this means is that we determined, based on the dates provided, that the case was not in the building while they were infectious. So this means that the risk is low of there having been transmission from that case to others in the building. However, if we understand the dates to be that a case was in the building while infectious, this means that we may have to provide notifications to the people in the CPS building at that time to let them know that they had potentially been identified as a close contact and would therefore need to quarantine. So the other part of the notifications that go out is the cleaning notifications. So it can be divided as far as the action following a case. It can be divided into communication to those affected. So that's either the people who have been identified as close contacts or just the people in the school community who are just generally notified about the case. And then the other side of it is letting the facilities teams know which specific areas of the building to clean and disinfect with those sprayers that Jamie talked about earlier. Meanwhile, we have to let the individual cases know that they have to isolate away from others and will not be allowed in CPS buildings until their period of isolation is over. So we calculate isolation as 10 days after the first date of symptoms, or if asymptomatic, the first date of test. So they're able to come back on the 11th day, and that will all be shown in the CPS systems on a no admittance list for the school-based staff, specifically the principals. Another condition of returning is being symptom-free. So the 11th day is only if the other conditions are also met. So no fever, you're feeling healthy, and you've completed those days at home without coming to school. So I've mentioned the definition of a close contact before. We just want to mention that the school-based contact tracing goes a little bit beyond just the strict definition of close contact, in the sense that if a case is instructional related, which means that it either involves a student or a staff member who is in a classroom, then that pod structure that Jamie referred to earlier would be considered an automatic consideration or identification as a close contact. So if a child in your child's classroom has COVID, even if they weren't necessarily within 6 feet for a duration of 15 minutes or more, since they're in the same pod, they will have to quarantine. So flipping a pod to remote is something that may happen for those instructional type cases. This is something that a principal has the discretion to decide if they're awaiting our investigation results. So if they are aware, based on a self-reported COVID result, that there is a case in a certain classroom or pod, and they also know that it was onset within the last 14 days, then they have the ability to communicate to all the families to preemptively switch to remote learning until the results of the investigation are known. So the two possible outcomes of that is if the case is determined to be non-actionable, they would flip the pod back to in person. Or if it's determined that the pod needs to quarantine, then everyone would just continue learning remotely as a result of that case. Next slide, please. Okay, Jamie's going to go over the notifications. And again, this is when a case is determined to be actionable, which means that the case was in the building while they were infectious.
Yeah, so once the investigation is complete, so doing the interview with the person who tested positive for COVID-19, we do several notifications. So the first thing is we let anyone who is identified as a close contact who needs to quarantine know that they're a close contact, and we send them quarantine instructions. They're given the instruction to stay home for 14 days after the exposure happened. So we provide letters via email from contacttracing@cps.edu with all the dates and relevant public health information. The entire school community is then also notified of the case by the principal. There's no further action based on that notification. That's just so people in the school are aware. And then if you are identified as a close contact in our investigation, you may also receive a call from the Chicago Department of Public Health, which uses the phone number 312-74-COVID. And that's part of the larger city-wide contact tracing program. So we don't do calls, we just send emails with the letter, and then the Department of Public Health does follow-up quarantine calls with our close contacts. So again, a quarantine refers to the practice of separating individuals who had close contact with someone who had COVID-19 to determine whether they will develop symptoms. So quarantine reduces the risk of transmission of of COVID-19 in case an individual becomes positive in those 14 days. I do want to reiterate as well that a negative COVID test does not release you from quarantine. You do need to quarantine for the full 14 days per Chicago Public Schools and Chicago Department of Public Health guidance. So for students, if one of the students is quarantined, they switch to remote learning as long as they feel well enough to learn remotely. They can go ahead and continue learning at home. And for staff, they will remain home. And if they feel well enough, they will also telework from home. So just wanted to flash this report method again. So if you or your student tests positive for COVID-19, you report your results at cps.edu/COVID results. If you need support on accessing that form, you can always call our hotline as well, which is 773-553-KIDS. So thank you so much for coming to learn more about contact tracing. And at this time, we can take questions.
So if you have any questions, you can ask them in the Q&A section or the button that's at the bottom of your screen. And we can answer them live for you. Okay, so we have a question here. So it says, if one of my kids is quarantined as a close contact, do my other kids have to stay home?
That's a great question. So a close contact is a first degree contact. So the first degree contact is someone who has come in contact with someone who tested positive for COVID-19. A second degree contact would be the situation that you're talking about, where you come in contact with someone else who came in contact with COVID-19, with someone who tested positive for COVID-19. So in that situation, as long as your child did not test positive for COVID-19, your other kids would not have to stay home as long as they did not come in contact with the person who tested positive, and as long as no one has symptoms.
Perfect. Are there any other questions? If not, then I have a question. The first, we get asked all the time, will parents be able to, if they ask for it, will they be able to get a copy of the presentation that you have, or like a little blurb, I guess?
Yeah, we can definitely share this. There's also a lot of information on the public website that we can send links to as well about how contact tracing works.
Perfect. And then we get this question a lot, and parents like to know, will you ever tell them, or other people tell that, or other people in the school population, who exactly got COVID? So let's say if it was, Miss Smith, who was teaching the students, will you ever tell people that it's Miss Smith that got COVID?
No, so we are not allowed to share personal health information. Any of the health information that's disclosed during our investigation is private. We do not share that. The only thing we disclose is if that someone in the building tested positive. We do not say who.
Are there any other questions? I don't see any in the Q&A section. If not, I can keep going, keep asking you questions. So you talked about flipping a pod, and you said that the principal has the discretion to decide if they are going to flip the pod. Does the principal also just have the discretion to choose how long that will stay in place, or is there like a limit to how long they can do it?
No, that's really only meant to be a temporary solution while they're waiting for our investigation. And our average turnaround time from the moment we receive the self-report to it being investigated and notified is about 24 hours. So it's really kind of that situation where you have a case reported at 8 p.m. the night before, the principal knows about it. They know that the case or the child or parent had been in the, the teacher had been in the building, in the past 14 days. And so based on verifying that information, they would consult with their network chief, report that to us via the Google form, and then the families would be notified. And then probably within the next day or so, you would have the official notifications from our contact tracing investigation.
Perfect, thank you. So can you just, I guess briefly just reiterate can you give us an example of, like, you can use, I guess, fake names of, give us a scenario of how the contact tracing would work, and kind of like use fake names just so we can see how the steps will be taken.
Because I was also wondering, so if one kid in the pod gets COVID, right? every kid in the pod has to stay home, right? And then every kid's siblings has to stay home too, because the one person in the pod got COVID. So therefore, if they go home, they don't, I mean, okay, so I'm trying to get this. So one kid in the pod get COVID. All the other kids have to go home. But all the other kids that were in the pod, if they have siblings, do their siblings have to stay home too because the one sibling in the pod, or can they still come back to school too? Sorry that was long, but.
Yeah, no, this is definitely a confusing concept. As long as no one has symptoms, the siblings can come to school. And as long as the siblings did not come into contact with the person that tested positive for COVID.
Okay, thank you.
Mm-hmm.
However, if the person who is quarantining does get tested, which we encourage all people who are quarantined to get tested, and they become a case themselves, so it turns out that they were infected either through the case who had been in the pod or through some other source, then their sibling would become a first-degree exposure to their sibling, as opposed to a second-degree exposure to their sibling's classmate.
Yeah, and this is when it's really helpful for the Department of Public Health to reach out to our close contacts. So they will talk to the families and give them advice based on how they're feeling or the situation. And then we do very in-depth interviews as well. So if a family has several students, we'll talk through all of that and give advice to the family and to the school based on who should quarantine.
Please, I understand but I just have this one more thing. So if you're okay, so the student who did catch the COVID, if all those siblings, say for instance, they go to the same school, because I know about 4 kids, but they're in different grades. Every pod that family came in contact with got to stay home. Because if the one sibling got it and they in the same household and they found out that they got it, and the other kids that are in the household with them, they do go to the same school and they're going to go to their pods, maybe they get it too. Would those parents be contacted? Would they have to stay home too? I mean, you see what I'm saying? If one household got it and one household has a whole lot of kids and they go to the same school, then how would that work?
Yeah, so it really depends on the investigation and the dates of testing, the date of symptom onset. So if we have a household who has all tested positive for COVID and they are part of multiple pods, we interview about each student and identify if they were if they were with their pod on the dates they would have been contagious. And then we would, if they were, we would quarantine several pods. But it really depends on the situation, and it hinges on our interview and investigation.
So helpful, ladies. Thank you so much.
Okay, so I have a question. So for parents who have children at different schools, do they have to notify each school, or is the online form sufficient enough?
Oh, sorry, Liza, do you want to?
No, you go for it.
The online form is the most essential part of the process because that will kick off our investigation. And then we will notify the principals after our investigation is complete if we identify that it's actionable. So you don't have to notify your principal if you don't want to.
And just to clarify too, if the online form that we're talking about is to report a positive case that your child may have, as opposed to maybe you have, your cousins, your child's cousins are in daycare, which is not CPS, and you find out that your cousin had COVID. So really your child is considered a close contact of them. Then you wouldn't need to notify us of that through the form, because there's not a confirmed case of your child at that time. It would only be if you have a positive test result in hand or in your email that you would be reporting to that form for us to then go through our process of interviewing.
Okay. So we have a question. Again, I think someone is asking once again, so if my child gets takes a COVID test and it's positive, will the teacher tell the other students that that particular child has COVID, because they are currently worried about bullying from other students?
That should absolutely not be happening. No one should disclose other people's health information. We've done a training for all principals, as well as we're launching a training for staff to understand that legal requirement. So no, the only thing that would be disclosed is, someone in our pod tested positive. No one should be saying, sharing other people's health information. Now, if the child decides to share it, we can't really stop that.
Perfect, thank you. We have another question, and it is, will the principal find out who is positive? So will the principal receive the name of the person who's positive?
We do not share the name of the person who is positive with the principal. A lot of times, parents and staff choose to share that information with the principal themselves, which is fine if they want to do that. We do not, the only thing we share is what we call no admittance dates. So that is the dates that people are not allowed in the building. So that usually that's a group of people, like everyone in a pod are not allowed in the building until this date. And we would not identify whether someone is a close contact or the positive case.
Great. So one question is, so if my child is positive, do they still have to participate in remote learning?
So if they're well enough, we definitely recommend that they continue their learning experience. But if they are sick, you can call them in as being sick, just like you would if they were attending in person.
We have a question. It is, how long do you expect to be doing contact tracing? Like, how long will this process go on?
That's a great question. We've always done contact tracing in the district for other infectious diseases. So they're definitely not, the other infectious diseases are not as widespread as COVID has been. So we will continue doing contact tracing as long as there's infectious diseases to trace. It may not be at the scale it is right now, but we will continue.
Okay. So kind of going back to this, if a student has COVID, students will notice I guess, the long absence of a particular student. And if children start asking, why is this person not in class with us? Is there a response that the teacher will give so that I guess we also prevent this like bullying part of having COVID or not having COVID.
I think one thing to point out is just that anybody can get this disease. We're in a pandemic. It's spreading like wildfire. We're trying to contain it, but it's not anybody's fault for catching it, and it doesn't discriminate between different people. So it's a very infectious disease, and we're doing our best to mitigate that. But there's no fault that should be placed on someone who does become sick from the disease.
Yeah, and I think too, there's several reasons that people may be out of school. So you never know. It could be related to COVID. They could have tested positive, or they could have had a personal exposure. So even if you were exposed to someone who tested positive in your household, for example, or a cousin or a grandma or grandpa, they would have to quarantine for 14 days. And while they were not positive, they are still quarantining. And then there's the usual reasons for being out of school. So colds and allergies and the flu, those things can all still happen in COVID as well.
Of course. And then I have another question. So, I've heard parents say, how do we, parents could also send their kids, if they have a fever, they could just take a Tylenol. And then when they get checked at school, it'll appear that they don't have a fever. How do you make sure that, that you are, I guess what I'm trying to say is how do you make sure that students are as least exposed as possible? I don't know if that question made any sense.
So this goes back to the Swiss cheese model. None of our mitigation efforts can stand alone to mitigate. They all have holes, right? So you just referenced the temperature screening. That's not 100%, but we complement that with the health screener and contact tracing and wearing face coverings and reminding people to use hand sanitizer and wash their hands and stay socially distant. All those things together really support mitigating the spread of COVID.
And how often will students be tested for COVID? Is that something that they will be doing? Is it like a daily, bi-weekly, monthly? Will they get tested at all?
So there is a student surveillance program happening. I don't know the details very in depth at this moment, but I know Allie's been on a couple of these series talking about several things. So we can definitely provide follow-up. But surveillance testing is usually random selection, and there's a certain amount of time, like they may get it weekly or bi-weekly, but it's randomly selected. It's not required. Parents would have to opt into that program. So, it's up to the parent if they want to participate if they're selected. We do have a resource. Oh, sorry, were you gonna?
No, I just wanted to say too that there's always the possibility of seeking testing through the citywide sites, not necessarily through CPS. That will still be ongoing. And if your kid is quarantined, they should seek testing. And if they're experiencing symptoms that appear COVID-like, then they should also seek testing through any of those means.
Yeah, and we have a list on our website of pediatric sites to get COVID tested at as well. We'll make sure to share that.
Thank you. And then just to ask just one more time, just so we make sure that it's clear, there is the contact tracing, the daily temperature checks, and the oh my gosh, there's the pods to make sure that it is contained, is if there is an outbreak, that it is contained as possible. There are air purifiers. There are plenty of different methods that work in conjunction to make sure that everything is as safe as it can be for for everyone involved, students, staff, even down to the, the janitorial staff. So if there are no other questions, I'm going to ask one more time. If you have any other questions, please ask them in the chat. If not, I am going to close out for today. And again, you can see on the screen all the many different ways that they are trying to prevent the spread of COVID-19 while also making sure that our students have this in-person learning that is invaluable. So let's see. So we have a question, last question. If a student comes in and doesn't show any symptoms, but the family turns out that one of the family members is positive, does the child have to come back home and do online learning?
Yes. They would need to quarantine because they had a exposure to the virus in their personal life. So that's something they would account for in the daily health screener response. So their parent,
Okay.
or if their mom, for example, had COVID and exposed a child, then in the daily health screener response, they would write that their student wouldn't be attending in person because of a COVID, exposure to COVID in the past 14 days, and they would have to stay out for that full period and get tested to themselves, isolate if possible in the home.
Great. All right. Well, thank you so much. This session the information is, again, invaluable. It is something that, is important to know, how things are how things are being put in place to make sure that everyone is safe, and make sure that we do everything that we can possible to protect our students, our future. So we hope that you enjoyed today's session titled How Contact Tracing Works. Our classes are recorded and can be found on our YouTube channel at bit.ly/faceyoutube, and that link will be dropped in the chat. And please visit our website at cpsparentu.org for more information on our virtual programming. And please follow us on social media at CPS Parent U on Facebook, Twitter, and Instagram. And sign up to receive news for our upcoming workshops at bit.ly/faceparents. And thank you again to the Office of Student Health and Wellness for helping us and helping parents understand a little bit better what's going to be put in place to protect our students. I really appreciate it.
Thank you. Thank you for having us.
Yeah, thank you.
Of course. Thank you.